Did you know that after age 60, your blood pressure goal could decide how long and how well you live? That simple number, 130/80, might just be the most important figure in your health journey. Hello everyone, and welcome back. Today, we're diving into some very important health news for older adults. If you're over 60, or if you have parents and loved ones in that age group, this video could truly make a difference. Blood pressure isn't just a number on a monitor. It's a reflection of how hard your heart is working, how flexible your arteries are, and how healthy your circulation remains as you age. And now, new research shows that keeping your blood pressure under 130/80 can significantly reduce your risk of heart disease, stroke, and even dementia. In 2025, the American Heart Association and the American College of Cardiology released updated blood pressure guidelines. These updates confirm something that doctors have been seeing for years. No matter your age, keeping blood pressure below 130/80 millimeters of mercury helps protect your brain, heart, and kidneys. Now, some of you might be thinking, wait, didn't older adults used to have a higher target, like 140 or even 150? Yes, that was true in the past. Doctors often allowed slightly higher readings for seniors, thinking it might be safer. But newer studies, like the SPRINT trial and later analyses, revealed that lowering blood pressure more aggressively, when done carefully, actually reduces heart attacks, strokes, and death rates in people over 60. In fact, seniors, who maintained an average of around 125/75, showed fewer cardiovascular events and better cognitive function over time. That means, even after retirement, keeping your numbers in check can help you stay sharper, live longer, and maintain independence. Across the ocean, the European Society of Cardiology agrees, but with a slight nuance. They recommend that healthy older adults aim for systolic pressure, that's the top number, between 120 and 129. While those who are frail, or have multiple health issues, can safely stay under 140. So overall, the global message is clear. The ideal zone for most seniors is between 120 and 130/80. Going much lower can sometimes cause dizziness or fatigue. But staying higher can quietly damage blood vessels over the years. Balance, as always, is key. First, check your blood pressure regularly, not just at the doctor's office. Home monitoring gives a clearer picture of your daily patterns. Try to measure it in the morning before breakfast or medication, and again in the evening. Sit quietly for 5 minutes before measuring, keep your arm at heart level, and record to readings 1 minute apart. Over time, you'll start to see trends, and that helps your doctor fine-tune your care. Next, let's talk about food, because diet plays a huge role. The DASH diet, that's short for Dietary Approaches to Stop Hypertension, remains one of the most effective eating plans ever studied. It focuses on fresh fruits and vegetables, whole grains, lean proteins like fish and poultry, and low-fat dairy. Cut back on red meats, processed foods, and anything high in salt. If you can, aim to keep your sodium intake below 1,500 milligrams per day. That's about 2/3 of a teaspoon of salt, less than most people realize. Instead, season your meals with herbs, garlic, or lemon juice for flavor. Exercise doesn't have to mean joining a gym. Even simple daily activities, brisk walking, light gardening, or dancing, can help lower blood pressure. Try for at least 30 minutes a day, most days of the week. If you enjoy it, you're more likely to stick with it, so find something that keeps you moving and smiling. Maintaining a healthy weight makes a major difference. For every 10 pounds you lose, you can drop your systolic pressure by 5 to 10 points. Also, moderate your alcohol. That means no more than 1 drink a day for women, or 2 for men, and ideally, a few alcohol-free days each week. If you're already taking blood pressure medicine, remember, consistency matters. Take your medications exactly as prescribed. Don't stop or change your dose unless your doctor advises it. Some people may need 2 or more medications to reach their goal, and that's completely normal. Think of these as tools, not punishments, that keep your heart protected. And of course, stress. Even when everything else is right, stress can make blood pressure spike. Find your calm, whether it's deep breathing, meditation, prayer, gentle yoga, or spending time in nature. 10 minutes of relaxation a day can lower stress hormones and ease your heart's workload. As we age, we often focus on what we can't control: aches, slower metabolism, new prescriptions. But blood pressure, that's one area where small changes make big differences. The beauty is that you don't need perfection. Every drop counts. Lowering your systolic pressure by just 10 points can reduce your stroke risk by 30 to 40%. That's huge. So talk to your doctor, stay informed, and make blood pressure awareness a part of your daily life. The more you understand it, the more power you have to protect your health. Managing blood pressure is not just about adding years to your life. It's about adding life to your years. By keeping your numbers near 130/80, you're giving your heart, your brain, and your body the best chance to stay strong. So check your numbers, make those small changes, and keep moving forward, one heartbeat at a time. And before we wrap up, may I kindly ask for your support? Your subscription, your likes, and turning on the notification bell truly help us continue creating helpful videos like this one. Thank you so much for watching, and take good